Alright guys, in this lesson we're going to talk about aseptic technique. So why do we use aseptic technique? Well, there's 4 main points, really. The first one is that they prevent infections. The reason we want to use the right stuff all the time is because we want to keep those infections down. They're also required by policy. They also maintain the integrity of the IV itself. And the last thing is it reduces other complications. So when we talk about aseptic technique, what are we talking about? The first one is we're going to use the ChloraPrep first. This is always going to be your first line. And the reason is because chlorhexidine and alcohol together have been found in nearly every study that they prevent infections and complications far greater than the use of any other antiseptic. There are instances where the alcohol prep is appropriate, but the majority of the time you're going to use the ChloraPrep, especially since it's included in your IV kit. The first thing you want to do is you want to identify where you're going with the IV. You usually only get one of these guys in your kit, so you want to make sure that you use it wisely. So identify that location. The next thing you want to do is activate the device. This usually works because you're squeezing these two together and it bursts this little capsule inside and then it'll be absorbed in the sponge. Then you want to start at the location of the IV insertion site. Then you want to wipe in those concentric circles going outward, and you never want to come back to center. The other thing you'd want to do is always allow it to air dry, and this is because the antiseptic is most effective when it completely dries. Always make sure that you also use some friction and some rubbing to break up any of that bacteria and to destroy it. And the last thing you want to do is you've seen nurses do this, you never want to do it though, is waft. And when you do that, you're actually introducing bacteria back onto that insertion site, and we never want to do that. So I hope that these tips about aseptic technique when you're putting in their peripheral IVs have been very helpful. Now, like we always say, go out and be your best selves today, and as always, happy nursing.